All right, let's talk about vaginal health treatments. Today, we're going to cut through all the noise and the marketing hype. We're going to get straight to the facts based on the official UK clinical guidance so you can make choices that are right for you and your body. Let's get right into it.
But first, let's just start with a question that honestly needs asking. Why is it still so hard to talk about these things? So many of us are dealing with this stuff, yet we're often made to feel like we have to suffer in silence. Well, not today. We're bringing this conversation right out into the open.
And look, if you're experiencing any of these, I really want you to know you are so far from alone. We're talking about things like vaginal atrophy or stress urinary incontinence. These are incredibly common. As you can see from this list, these are widespread and, more importantly, treatable health issues that absolutely deserve proper medical care.
Now, trying to figure all this out on your own can be, well, overwhelming. That's why you need a guide you can trust. So let's introduce the expert whose clinical experience is going to anchor everything we talk about today.
This is Dr. Farzana Khan. And when we say specialist, we really mean it. She's got over 2 decades of hands-on medical experience, and she holds key qualifications from the Royal College of General Practitioners and the Faculty of Sexual and Reproductive Healthcare. Her entire career has been focused right here on women's health.
And you can see her dedication right here. This isn't something she just picked up recently. It starts all the way back in 2003 with her medical degree, moves into her specialization in gynecology, and builds until today, where she's actually a key opinion leader who trains other doctors on this stuff. That's a real journey built on commitment.
Okay, so with that solid foundation of expertise, let's talk about the treatments that, let's be honest, get most of the attention. You know, the high-tech solutions you see advertised all over the place, often promising that perfect quick fix.
We're talking about what are called energy-based devices. In simple terms, these are machines that use things like lasers or radiofrequency. The idea is to send controlled, gentle heat into the vaginal tissue to kind of wake up your body's natural repair system. The goal is to stimulate new collagen, which in theory should make the tissue healthier and more elastic.
Now that sounds pretty promising, doesn't it? But what's the real story? What does the official medical guidance here in the UK actually say about it? This is where we need to separate the marketing from the medicine, and we're going to do that by looking right at the guidance from NICE, the National Institute for Health and Care Excellence.
And here it is. Honestly, if you only remember one thing from today, make it this. NICE, the organization that sets the healthcare standards for the entire UK, says the evidence for these devices is, and I'm quoting here, limited in quality and quantity. In other words, the solid, reliable science just isn't there yet.
And because that evidence is so shaky, NICE says that any clinic offering these treatments has to operate under what they call special arrangements. And let me be clear, this isn't a casual suggestion. It's a set of very strict rules. It means the clinic needs tight oversight, they must get your consent that you understand the evidence is limited, and they are required to track and audit the results for every single patient.
This slide just lays it out so clearly. It really shows the huge gap between what you might read online and the official reality. A marketing claim might say it's a revolutionary solution, but the regulators say the evidence is limited. You see promises of quick results, but the guidance says long-term safety is inadequate. And maybe the most important one, it's not a first choice. It should only even be on the table after proven standard treatments haven't worked.
So if these fancy devices aren't the place to start, what is? Well, any reputable clinic, one that's actually following the NICE guidance, is going to walk you through an evidence-based pathway. It's called the hierarchy of care.
And here is that official roadmap. I really want you to notice the order. Step 1 always starts with the basics, lifestyle changes, pelvic floor physiotherapy. If you need more, you move to step 2, which is the gold standard, proven treatments like topical estrogen. And only if those first 2 steps don't give you relief, or they aren't right for you medically, should a doctor even begin to consider an energy device. It's the last option, never the first.
Let's just focus on that gold standard for a moment. Why is it the top choice? It's simple, really. For most women dealing with vaginal atrophy, topical estrogen gets right to the root of the problem. It's the most effective, most researched, and safest treatment we have. This is the established frontline medical solution for a reason.
So what does this all boil down to for you? It means you're now empowered. You're in the driver's seat. You have the official framework to ask the right questions and to make a truly informed decision about your own health and your own body.
Think of this as your practical checklist, taken straight from the guidance. Before you say yes to anything, ask these questions. Is the clinic being upfront that the evidence is limited?
Do they tell you the results might not be better than a placebo? Have they made sure you know about standard alternatives, like estrogen? And are they actually auditing their results like they're required to? You need a confident yes to all 4 of those, minimum.
And that brings us right back to the philosophy of a truly patient-first expert like Dr. Farzana Khan. You see, her approach isn't about selling you the latest shiny gadget. It's about clear explanations, realistic expectations, and making a decision with you, not for you. And that, right there, is the sign of excellent care.
Of course, it's really important to remember that this explainer is here to educate and give you that official framework, but it is absolutely not a substitute for having a real, one-on-one conversation with a qualified doctor about your own specific health situation.
So we'll leave you with this thought. You now understand the official standard of care, you know the critical questions to ask, and you know the difference between marketing hype and actual medicine. That knowledge is power. So the real question is, what's the first thing you're going to ask?